To get a professional opinion, Katie's meeting Dr Courtney Raspin,
Hello, hi. Well,
a psychologist specialising in eating disorders.
So tell me about your body image before.
really, my body's just a functional item.
I
And
see.
it did great things, like it could just run forever, so I can do a marathon.
So you saw your
Yeah.
body in a way as kind of this vehicle of strength.
Of being tough.
Running fast, being lean, pulling yourself together is
Yeah.
part of what gives you that armor. It's very difficult for her to feel compassion for herself and kindness for herself. Her way of coping when things feel hard is to toughen up, zip it up, and go for a run. And without that, I think everything crumbles and falls apart.
Dr Raspin was really helpful last time. In many ways, she unlocked the whole relationship between me, my epilepsy, and how I feel about myself.
I think coming into this, you had a really rigid view
course.
about being fat.
Yeah,
That being
definitely.
fat is weak and
Yes.
being normal or thin is strong. How much has that shifted, that kind of dichotomous view?
Massively.
Okay.
And for me, it's so empathy, sympathy. Do I sympathise with fat people? Not at all. Have I learned empathy, how it feels, as if it's me feeling it? Absolutely.
It's Michael's job to tell you what to do right now. He's not the one who has all this weight to lose. He was fat. And he lost all that weight, and he knows what it takes, and he sees that you can do it. And if you want my opinion, I think you should be following his advice at this point, okay? Because he hasn't steered you wrong. Look at you. You're amazing. And I think it would be a real shame over an argument, that a whole relationship and a potential for him to help you go even further just goes out the window. When you're shut in, you lose touch with reality in a way, because you have no way of testing what is normal and what is not normal in the outside world. I think it's really important for the two of you to start doing things together as a married couple outside of the house and getting you out. Do you try and encourage her to go out and do things?
Not as much as I ought to. If Sharon says, "Oh, I don't want to go out, I want to stay in all weekend,"
Yeah.
because that's the way I'm inclined as well, I don't really argue with her. I just say, "Yeah, okay then."
What you see with Andrew and Sharon is that the process of change is actually very, very complex. There are psychological factors, there are social factors, and that change isn't just about eating a bit less and moving around a bit more. Why does somebody continue to eat and eat? We can all think about a time when we overate. And if you think about what that's like, that feeling, most people say, "Oh, I felt a bit guilty." I said, well, what happens right before you felt guilty? Right before. Because you feel incredible fullness. And it completely blots out anything else that's going on. In people who have disordered eating, they use food as a way of coping with anxiety, with loneliness, and with stress.